Well, thank you everyone for joining us today for our breakout session, Public Health Communication in the Age of COVID-19, Lessons from Somalia. We are truly honored that you have expressed interest in our work and our approach as this response continues to evolve. If you are joining us via the Zoom chat, please do introduce yourself over the chat and let us know where you're calling in from. My name is Nishant. And I manage the Response Innovation Lab in Somalia, and it is my honor to introduce to you our panel.
My name is Abdi. I'm the Response Innovation Lab Senior Coordinator.
My name is Matt Erickson. I'm a digital producer, educator, and innovator who loves to use creative ways to engage behavior change in difficult environments. I've worked for 11 years in East Africa, including Somalia. I've worked in the diaspora communities in Minnesota, and my latest project is called Geedka Moska, which means the banana tree in Somali. I work with Poet Nation Media and Grit Partners here in Kenya, and it's an early childhood educational program for Somali-speaking children.
Khaled here with Go EMR, a provider of digital health solutions designed for Somalia.
So a quick overview, the Response Innovation Lab is a global collaborative platform whose founding members include World Vision, Save the Children, Oxfam, Civic, and George Washington University. The RIL is not a legal entity. So in different countries, we are legally hosted by one of our founding members. In Somalia, we are under a resilience consortium called SOMREP, the Somali Resilience Program, to which World Vision is the legal agency.
Well, now with regards to the COVID-19 response, very simply speaking, there are two broad components, one around information and the second really around access. Now, what I mean by this is one, if you are providing people with information telling them to say, wash their hands with soap, this would then eventually lead to the second part, which is making sure that people have access to things like soap so that they can act upon this information. Now, the RIL is currently involved in both of these aspects, supporting initiatives in both. But for today, what we wanted to do is we wanted to share with you our experience around this information aspect of this response and how we were able to support others to really mobilize quickly to develop Somali contextualized public health awareness tools before most other actors, and how this content was then adopted and scaled very quickly. Therefore, today's presentation parameters are really focused on the early days of the COVID-19 response in Somalia and how we worked with others to really set this foundation. So please keep in mind that this is an ongoing response and we're right in the midst of it. And I'm sure that once the chaos settles, we will be able to have some formal research around this. But for today, we've kind of identified kind of four broad themes that has really helped us to mobilize and respond quickly. We've brought together a really interesting panel of innovators that we have worked together with on this experience, and we'll be sharing our experiences around one, the co-creation process and approach, two, how we were able to leverage unifiers in complexity and in complex environments, three, how we built off of these unifiers to influence behavior change, and then four, how we designed this to allow others to adopt these tools and to scale it quickly, which then has led to a multiplier effect. So we will then close kind of with all of that with kind of a summary and some key takeaways that we hope are transferable to other contexts. And then we'll have some time for Q&A where my colleague Emma will be monitoring the Zoom chat and we'll be pulling out some questions there to pose to the panel at the end. Now, because a picture is really worth 1,000 words, let's just begin with a quick highlight reel to showcase some of the work that we've helped support.
marka aad raacdo talaabooyinkan fudud waxaad naftaada iyo bulshadaba ka ilaalin kartaa qaadida iyo faafida COVID-19 si joogto ah ugu dhaq gacmahaaga biyo iyo saamuun muddo 20 ilbiriqsi ah. Ha taaban afkaaga, sankaaga iyo indhahaaga. Waanaad iska dayso taabashada waxa ka mid ah gacan ruxid, weji ruxid. Marka uu qofku gacanta ku taabto indhihiisa, sankiisa ama afkiisa, ku salaan dadka. Ka badbaadi naftaada coronavirus adigoo ka fogaanaya goobaha ay dadku ku badan yihiin.
ومهم أن قعمها دخنا مرولبا أنت عندك عنين خرا سدي جري مسك قعمها أنا ودينا ونودرني وللك آية سعديو أنا قعمها دخنا
waxa wanaagsan inaad joogtid gurigaaga marka aad xanuunsan tahay, marka aad qufacaysid ama aad hindhisaysid inaad dabooshid afkaaga. waxaana sii wanaagsan inaad ku dabooshid afkaaga meesha uu ka laabmo xusulkaaga.
waxa kaa soo daadanaya jeermi badan baa kaa soo daadanaya bacteria dadkay gaaraysaa, dadkii kula fadhiyay gaaraysaa. ma aragteen markaad hindhisaysaan iyo markaad qufacaysaan dabool afka.
The first enabler in our approach was our co-creation process. So for a bit of background, the ethos of the Reels model, our collaborative platform, is built around the idea that traditional humanitarian actors don't have to be incubators of all the innovations and solutions. What was really needed in this area was better collaboration, and this is what brought the three of the world's largest NGOs together. Very simply, our approach has three main pillars. The convene, this is our function, bringing people together and understanding what is very hard to be innovated. We work with existing structures like clusters to leverage existing networks. And we also do things on our own where we curate those that attempt to ensure non-traditional humanitarian actors are involved, like academia, the private sector, coming together within NGOs, UN agencies, and government. The second function is the matchmaker. This is a mechanism for pairing challenges. We identify with existing solutions that have some sort of proof of concept. And then the third function is support, where everything else falls under this, but basically once a potential solution has been identified, we then look to co-design a pilot, support with resourcing that pilot, and then gathering evidence around it. So very plainly speaking, the Reel acts like a broker that support actors that are directly implementing activities.
Now, let me start by giving you a bit of background to set some context. Now, through our network, the Reel was working with a Somali health startup called Ogo EMR, and they had actually won the Open IDO Challenge, and they had received some seed funding from the Gates Foundation. Now, a really neat feature as part of this larger digital health platform was that they had a library for public health content and videos in the Somali language. Now, through our matchmaker function, the Reel brokered a relationship between World Vision and Ogo EMR to test this platform at some World Vision supported clinics. Now, when it comes to the COVID-19 response, with the virus kind of spreading around the world, I reached out to Khalid, the founder of Ogo EMR, and I suggested that they start adding to that library of public health information and add videos around specific to COVID. And so Khalid and his team started to work on developing messaging around this before there was even a confirmed case in the region. And when there was finally a confirmed case in Mogadishu, that same week we released the first video, and it very quickly took off because it was the first kind of public health content information in the Somali language. Now, as it was beginning to scale and take off, we did a lot of consultations with a lot of different implementing agencies and realized that there weren't a lot of resources to mobilize quickly for a response. And so we then decided to mobilize our own resources and our network to help develop public health content that we knew would be reliable and trustworthy, and made it open source so that anyone can use it. And then that way, the limited resources that may be there weren't being duplicated with everyone producing the same video on hand washing, for example, so that those resources could be more efficiently used.
So before Somalia announced the first case, we knew we wanted to use our digital health platform, specifically our caregiver tool, to support Somalia's preparedness and response to COVID-19. Our platform is well positioned to push out contextualized public health content, as we have previously produced videos on healthy pregnancy and nutrition, which the Response Innovation Lab heard of. We initially had to put forth our own funds as we needed to move quickly, well before we partnered with the Response Innovation Lab and their partners to expand the series. And throughout the process, we had to make some compromises. Examples were scaling back on branding our banner so that it could be friendlier to adopt across many stakeholders, which we were happy to do in an effort to have a greater impact. And eventually it did, as many stakeholders, including government, ended up endorsing and sharing the videos. Next. We knew right off the bat that the information had to be credible and contextualized, and we looked towards the World Health Organization guidelines in an effort to ensure that that information was credible. We had a vast network of Somali public health folks around the initiative, including our Somali advisor at Johns Hopkins University, which added extra credibility to our initiative. We leveraged the Response Innovation Lab's network and reputation of being a collaborative platform, an umbrella of many NGOs, and the Response Innovation Lab quickly brought in input from their partners in the field, and we shared our storyboards and our animations before we pushed out that content. And by allowing for people to be a part of the co-creation process, it allowed for people to feel a sense of ownership, which later allowed for them to support, share, endorse our content.
So last year, we filmed a pilot episode of Gade Kamoska that had several WASH themes woven inside it. This was before any of us had even heard of COVID-19. And when this COVID crisis came along, Nishant from RIL, who we've met here, mentioned to me about this initiative. And I was able to quickly repackage some of our video content and add some specific info to the coronavirus that the WHO was putting out. We self-funded this project, but knew Nishant and RIL were moving quickly in partnerships and with their group of NGOs and relationships with donors, and as well as the government of Somalia, that we were able to then create these videos along with Ogo EMR, with Khalid here. And we continued to learn about these things as we went along, things such as branding, compromises on some of the videos to make them more adaptable. And through this process, it has led to collaborating on more complex initiatives or complicated ones, like radio programming. This has allowed Poet Nation Media, who I work with, to influence others with communicating complex topics in a simple and digestible manner. So I think Nishant, you're up here next.
Thanks. Now, please keep in mind, again, this is an evolving response, and we're moving from chaos to complex to complicated. Our approach has really helped to define challenges and needs very quickly, and then to mobilize people to put forth solutions that can be rapidly deployed. Although the output, I think, has been pretty neat and pretty great, foundational to this, I think, was more so the co-creation, collaborative approach and process. And key attributes to this were, we gave people the option to contribute right from the beginning. Again, as Matt talked about and Khalid, being involved from the beginning gives you ownership of the output. Another thing that we did was we got buy-in very quickly from humanitarian implementing agencies, those who had the ability to communicate the needs on the ground right back to us, and for us to incorporate that very rapidly. We also brought in non-traditional actors into the fold, those like in the private sector who were able to pivot and respond much more quicker. And then we had to find that balance of being open source, but then also setting up parameters to make sure that the content was solid and trustworthy. As a result of these approaches, we had actually 3 videos that were widely circulating before there was even an official approval process from the government, or even before the UN's kind of inter-cluster coordination mechanism was active. As a result of that, when those systems were in place, the 3 videos were retroactively approved. And then, of course, moving forward, we've followed that process and got the approvals before we pushed things out. But very quickly, again, donors, governments, NGOs quickly adopted it. The NGO consortium endorsed us very early in the days and basically encouraged all of their members to utilize us as a free resource to support and collaborate moving forward. Of course, then the private sector also came on board and circulated it towards their networks, which were slightly different from the traditional humanitarian networks.
Now, let's talk about finding unifiers in complexity. The question now to the panel is, what was your approach to developing messages that will be well received in Somalia? Now, let me start with Matt. Let's start with you and then go to Khalid.
Sure, thanks, Abdi. So over the past 20 years, I've been part of several programs in which cultural elements have been emphasized. These included things like the arts and poetry and storytelling, even music. And we found that culture is a unifier, even in a society that has been divided for the past 30 years due to war and other issues. In our videos, we have featured these things like Adir Dahir, like the older gentleman that we just saw there in the video. Adir Dahir means Uncle Dahir, and he's telling stories and encouraging children to wash their hands. It's a scene that's very familiar in the Somali community. And so these kind of things, they can bring nostalgia and just other good feelings that helps us deal with harder messaging. So as you see here on the slide, 60% of the population of Somalia is under the age of 25 years old. We've seen that it's strategic to target the youth and in this case, younger children, because there seems to be a tendency for younger people and youth to be more open to behavior change. And so we aim at making our messaging child-friendly, but not glossing over difficult things and the facts. So I think Khalid.
Throughout the Go EMR platform, we've always offered solutions that are easily accessible and offered in the Somali language. And our caregiver tool was no different. But our main unifier was the process, and it goes back into the co-creation approach that we spoke of alongside the Response Innovation Lab, which really allowed for us to have a really deep understanding of how our content would resonate with local communities in rural and urban settings. Next.
Having strong unifiers provided the basis for people to be open, to hear the message, and thus positively influence behavior change. The next question to the panel, how are you addressing complex topics in a complex environment? Let me start with Matt, and then Khalid to follow.
Yeah, thanks again, Abdi. So as I mentioned earlier, we aim to simplify the message and present a child-friendly way of using these cultural forms and with tactics that you might find being used by my favorite, my kid's favorite, Dora the Explorer or Elmo on Sesame Street. You know, we don't want to frighten children, but we want to help them to prepare to deal with these issues in a way that's good for their emotional health. The cultural aspect helps with this. You know, it builds trust. So we actually, like a phrase we like to use is we seek to build a bridge of trust that can bear the weight of complicated things. Things like female empowerment or sickness in the home or fear and emotional issues. When it comes to behavior change, there are a few tactics that we use as well, or maybe it's not the right way to phrase it, but research shows that children or people in general will change their behavior when they consider that it affects other people. So we try to show situations that where somebody will think like my action here will affect somebody else. We know that people will more apt to adapt that behavior. We're trying to weave that into our program, and when people make commitments, also they tend to follow through with them a little bit more. These are some of the frameworks that we use to build our program up.
At AgoEMR, we have always been very intentional with small details that many people could potentially miss. And gender balance was an important one for us, both visually and with voiceover. So all of our videos are actually led by a female voiceover artist, which we were able to create even an employment opportunity through that medium. We knew it was also important to show people of different ages. So in Somalia, 70% of the population is under the age of 30, but also displaying elders and having topics that speak to those at most at risk. We also had to touch on stigmas that COVID-19 is a global pandemic that many countries are facing that challenge as well, and Somalia is no different. And we designed our videos that the messaging could be shared in audio only. And then that really helped us share across multiple mediums. And of course, we included captions for those who had hearing impairments. Next.
Yeah, because of the intentionality of these three previous topics that we've kind of shared about, this allowed us to, to support the content, the production of content that could be quickly scaled and have this multiplier effect. So just kind of a real quick snapshot of some of that, the kid focus video, for example, was shared by the Minister of Health, who tagged the office of the president before there was any approval process from her own department. Of course, later on when that process was there, it was then, content was shared through official channels. But yeah, it was adopted really quickly. Another example is there's been numerous donors and embassies that have shared, the Swiss, the Australians, the Americans, to name a few. UN agencies as well. We didn't coordinate or target Djibouti, but the UN and Djibouti, picked up this stuff. It was also shared up by many actors in the private sector who, many innovation hubs who kind of saw this as really innovative, shared it amongst their networks, which then kind of rapidly started to spread. A reporter connected to the BBC who's got a massive following with almost 1 million followers on social media shared it on his personal accounts. NGOs used it to educate their own staff because they realized if their staff weren't well informed, it was challenging before they go out into a community and start informing them. One even embedded it as part of their beneficiary registration process. Others extracted the audio and used it on hotlines. So it was quickly adopted. The tool was designed, these tools were designed to be quickly adopted. So a question for the panel, what are your thoughts around this? Like, why do you think it was adopted so quickly and scaled so quickly? Matt, let's start with you.
Yeah, that's a good question, Nishant. Again, focusing on youth seems to be, for me, more effective, as if the content, and if the content's good, I think people interact with it more. Somali young people or youth are very active on the latest social media platforms. If you go out to the internet or any of the places that you find things online and just look around, you'll see some amazing people, Somali young people doing some amazing things that, and it's on more than just YouTube and Facebook. It's on Snapchat. It's on the latest things that I don't even know about, like TikTok, the latest technology that the young kids are using. There's some really cool, interesting things on there. And I think so. If your social media is good and relevant, it will be passed around primarily first in urban areas, and then you'll see a ripple effect, and it'll take place. And it'll work its way to less urbanized areas. With our video here, you see the picture. We called this video Tulada Wilasha. It means village boys. We saw our biggest viewership in Mogadishu, and then went down decreasingly, alongside the size of the Somali cities throughout the region. And this video actually appeared 130,000 times in people's Facebook feeds, and it was viewed actually 60,000 times. It went by 130,000 times, and people watched it about 60,000 times. And this was over a weekend, about 3-day weekend. And the most interesting number to me in that is that it was shared 340 times. This created kind of a small, I want to say viral, but I don't like to use that term these days, but it created this spreading effect that it helped it to be seen by this 130,000 times in people's feeds. Almost of the 53 comments, they were almost all glowingly positive. So for us, our target audience is a younger audience. But we know there are many mothers on Facebook. We also have this video on YouTube where it takes a little bit longer for it to grow. But we hope that the mothers, they share this content with their children. And we know that they are watching it as well. There's research that shows that. So currently, we are collaborating with Radio Ergo. It's one of RIL's partners to create more scripts for the COVID-related response and some more content. And the hope is that we air versions of this program, both in video formats and as well as on the radio. So Khalid, I think you're.
No, I think for us, it was really updating our partners on our process from approvals, from support and endorsements to keep that momentum going. So each week we would share out an email allowing for people to know where we're at, but also being very transparent with challenges. And as we reached more complex topics, we really leaned on our networks to ask if they could connect us to other individuals. So we were very grateful that we've heard from academics, Somali academics at Oxford, at Harvard, at the London School of Tropical Medicine, who really helped us think through many of those challenging topics. And then also sharing raw images that could be easily shareable across social media, helping organizations and individuals who were busy with quick shareable push notifications, and being even intentional that when we share that, we offered a Somali option as well, and several options for them to choose from, and hashtags and tags that were relevant to COVID and Somalia, all for easy sharing. And then, like I mentioned earlier, branding compromises, so scaling back on our bumper for organizations and stakeholders to be able to push that content and to reach more people. And it really goes down to that no one person can push a message, this type of awareness alone, and it takes a village to come across to support this work.
Great, thank you guys so much. So we've covered quite a bit of ground here, and let me just try and quickly summarize some key takeaways that we hope that are transferable to other contexts. One is that the COVID-19 pandemic has made people more open to collaboration, because business as usual just doesn't work anymore. I mean, if you look at a different type of response, let's say an earthquake happens, normally, globally, experts are deployed and they go on the ground and they set up a response. Well, that can't happen anymore. People are stuck in their home countries, or even in their own countries, they're stuck in their houses. And so this has forced people to be open to the idea of collaboration and working together and exploring new ways of doing things. Another thing that I think has been significantly foundational is this co-creation process, because it was foundational for the adoption and scaling of it. We ourselves, through our networks, we're quite lean, but we've leveraged other people's strengths to be able to get it out there. And I think key to that is if you bring people in early on in the process, by getting them to help review the scripts or come up with topics and priorities, they have skin in the game, they have ownership in that. And when the product comes out, they have ownership of that product, and they're more willing to kind of take that up there, endorse it, support it, share it, move it on. And then lastly, it was really like leveraging familiar unifiers in a culture that allows people to be more receptive to new information. You know, that illustration that Matt gave about, you know, building that bridge of trust that can bear the weight of new information, that has been significant because, again, there are many things that are unknown and can be scary or overwhelming. And so it's really trying to be able to connect with people so they're open to hear new things. So with that, let me just hand it over to Emma. If there are people who have questions for us from the chat, she's been monitoring that. Feel free to add and think about questions that you may have. And then of course, if you have more questions, there's our contact info there. But yeah, let me hand it over to my colleague, Emma.
Great. Hi, everyone. Great chat by all the panelists. If you do have questions, please go ahead and place them in the group chat box. I'm going to have a few to get us started. Can each of you speak to kind of individually, what was your biggest challenge going into this, and what were the lessons learned from that?
One of our biggest challenges, I think, was we were hearing from many individuals who wanted to reflect what they thought was most important. So kind of blocking out the noise and prioritizing, you know, what was a Ministry of Health, what were their priority areas, and how did we find ways to make that information stick to a local audience through our learning center.
Great. Nishant, what about you?
I think, yeah, one of the challenges has been that this has been, it seemed like, especially in the early days, that this was changing very rapidly and quickly. And so it was really hard to try and plan out things. It kind of accidentally, you know, it kind of kept evolving, and we were trying to rapidly, you know, there wasn't much that we can pull from. You know, the closest thing that we could reference was really the Ebola response and a lot of the lessons learned. And like kind of on the fly, because we're in the midst of a response, we're thinking this is some good practices coming out of the Ebola response. Let us try and quickly adopt that now into the fold here, because there's a lot of similarities and things that we can correlate from. So it was, the real challenge was really, how do you be relevant when things continue to evolve and change?
Great. And Matt?
Yeah, that's a good question. You know, like Nishant said, we're in the middle of a response. We're in the middle of a crisis. I'm talking from Nairobi, Kenya, where the curfew goes into effect in about 20 minutes and people can't move. And just today we heard the news that Eastleigh, one of the main areas of Nairobi, Somalis it has a lockdown that's going to be for the next 15 days where people can't go in and out. So for me, making some of these things and collaborating with some of these partners, I mean, this is what everybody's doing. We're not doing it face to face. It's a little bit harder when we're creating content, video and audio content, but we're adapting to the environment. We're using all the mediums for this, but it just makes things go a bit slower. It's harder to be rapid, but we're doing the best we can. It's, you know, things aren't perfect, but we're trying to, you know, really put out the right messaging. And so it can hopefully positively affect people's health and their lives.
Yeah, that's great. So a lot of you have talked about collaboration. It's been a word that's come up from each of you. And there's a great question from Ariel in the chat box that asks, you know, when you have so many cooks in the kitchen, how do you ensure that the responses are happening in a timely manner?
Yeah, no, I think for us, the Response Innovation Lab is a relatively new entity and a global collaborative platform. And I think before the COVID response, we spent a lot of time trying to build trust with people to know that we are an entity that is there to help collaborate and bring people together. And that has been quite well received. And I think when it came to then pivoting to, in a sense, activating it as part of a response, people were quite open to partner and work with us and to coordinate. And I think the other challenge has been, you know, this is a global situation, and and there are limited resources globally. And so people are now realizing, like, if we don't have a lot of resources, we need to be more intentional for the greater good to be able to use this. So yeah, I think part of it has been kind of that openness and the context, but then a lot of it we've been spending time trying to educate people over the last year is that innovation is not necessarily a mobile app. It can be low tech in a sense. It can be a process change. And I think, you know, part of our work over the last year has been to really educate and give examples of that. And I think when then this came about for the Somali response, yeah, it was being able to engage people and say, this is a collaborative, innovative process and be involved in this. And people were receptive to that. But yeah, I think it's really spending a lot of time educating people and giving them examples that they can lean on that, yeah, innovation is not necessarily something that's tech-based.
Yeah, that's great. Let's dive more into that as a question. A lot of people think of innovation as a product and something tangible that is new. Can you speak more to how this is innovation, how the videos were innovation? I'd love to hear more about that.
Well, I think the process is very much the same. So when we were first creating the Go EMR digital health platform, our EMR system, we co-created that entire process, and we had to lean towards caregivers and local practitioners to hear from them. And the Digital Learning Center was the exact same process. We had to co-create, listen, iterate, and change multiple times our processes. So I would say it's much more the process rather than it just being an innovation.
Great. I love hearing that. It really amplifies the way in which we think of innovation in our own lives and in our own work when we take it out of the concept of just a product or a thing, but actually think of it in the wider context. I would love to.
And I think it also goes back to us recognizing that we all have our limitations. And so, you know, in order to get something that is appropriate and holistic, it's bringing in those different people and utilizing them to their strengths. So for example, you know, the government that is coordinating and has this bird's eye view is able to give us priorities. They are able to see not just at the moment, but saying like, this is coming down the line. We need to start thinking about that. And so those are perspectives and insights that we ourselves as independents may not have. But when you bring people together, it allows us to create something much greater than we could on our own.
That's great. Kind of shifting gears a little bit, another question for the panel is COVID-19 has changed the world in many ways that you hinted about. The humanitarian response looks different. It's not a traditional response. How does this change the business? Like, you know, outside of COVID-19, like what are the learnings and the lessons that come from this that will change the way that you do work moving forward?
Well, for us, you know, we were in the midst of piloting at 2 sites when COVID first emerged in Somalia, and we've seen the toll that this had on our practitioners that we were training. We've seen the toll that it had on our local interns who are finding it challenging to come to the sites. And of course, we've seen the challenge with caregivers asking very difficult questions. So we knew we had to pivot very quickly, and we knew that our Digital Learning Center was a great opportunity for us to offer content that we could share within our existing pilot, but also to the largest Somali community at large.
That's great. I would like to ask a question towards Nishant. When you spoke about the partners earlier, every partner has, and you're collaborating with them, every partner has a different interest and a different stake in what's going on. How did you find that in this COVID-19 response, and how did you work with that? What were those challenges, but what do you see kind of moving forward, like coming out of that type of collaboration?
Yeah, I think I think this was, in one sense, the COVID-19 pandemic was an equalizer. It brought everyone it forced everyone to kind of stop and take stock of what is happening, because it impacted, even if you weren't a health-focused organization, it would impact you. And so that became, everyone had their own interests in terms of they all needed to come together for the greater good, to allow for the situation, because again, it impacts everyone. And I think what I've begun to see, which has made me, optimistic, is people are now, this has set a foundation for a new way of working and an openness to collaborate, because people are beginning to see greater impact and more efficiency in certain levels. And so, yeah, I'm optimistic that this will continue even beyond the COVID response. What's been interesting is being able to pull together entities that are massive and are a bit separate, but to come together to on proposals, for example, to seek funding, and saying like, we will now bring together our separate activities and initiatives, but now we will coordinate and work together, because we together we have a better footprint and the ability to leverage things together. So yeah, I think this is beginning to form a new way of thinking and approaching being able to do good and design interventions differently.
That's great. And just one more question for all of the panelists here. What advice would you give to NGOs, individuals, civil society members, even governments that are looking at doing preventative messaging around COVID-19, or not even preventative message, maybe actual messaging about where to go for services and whatnot? What advice, looking back at what experience you have had, what advice would you give them?
I would say that the messaging needs to be crafted, in appropriate ways, in a strategic way. I mean, definitely you want to have to lay the facts out there. You don't want to hide any sort of facts, but people do get alarmed about these things. So I think it needs to be, stated in ways that are without sugarcoating and without glossing over anything. But I think it non-alarmist would be a good tactic, as well as you have to win the trust of people. They have to see who you are and see that you are an organization that has some credibility, that you're connected with credibility. I mean, if you look at the names here that RAL is connected with, I think there's a lot of credibility there. I spoke earlier about cultural things. I think people like cultural things, and if you can show that, hey, this is the Somali community, we like these sort of things, people will be a little bit more receptive. So those are just a couple of pieces of advice I would give.
And I would add to Matt's, I think, of course, contextualizing the information, also identifying parties who can help push your content and co-creating alongside them. So not relying on them just to push the content, but also to help you co-create it. And I think we're very grateful to that the Ministry of Health sees a partnership with the private sector, and it goes back to not one person can do this alone, and working very closely with them in terms of standardization and further contextualizing that information. So really grateful that we were able to pull in across many different sectors to do something so great.
Yeah, and I echo those sentiments. I think the starting point really is recognizing that everyone approaches things with a different lens, and so really to develop effective messaging, especially when you're looking at a broad spectrum of demographics, is you need to bring people together. That's the starting point, because each person will bring a different perspective to the table that you yourselves as an individual won't be able to see. And if you only have, let's say, the NGOs talking to themselves, there is a limitation in that. So that's really the starting point, bringing people together to understand and to really develop kind of a holistic messaging around that. And then I think, kind of echoing a bit more what Matt was saying, is again, not being alarmist, but also giving people, making sure that your message is practical and relevant for the context. We spent a lot of time. We started with WHO guidance, but then we had to make sure that it was appropriate and contextualized and relatable and understandable to the specific micro-targeted audience. And we've shared many of those elements of how we did that, and like a broad message, but then made people resonate and relate to that and be open to hearing, the deeper message there.
Great. Well, that's all the questions that we have from this end.
Great. Thank you guys very much. Thanks, Emma. And thanks for all those questions. Again, our contact info is there. You can reach the Response Innovation Labs, our website, our emails, the same for OGO EMR and Poet Nation Media. Please do check it out. And if you do have follow-up, we're here for you. So with that, just thank you very much for your time today. We hope that, our experiences here in Somalia can provide some transferable lessons for other contexts. And yeah, thank you very much.
Thank you all.